So I'm going to jump in and start with Unit 4 group therapy first, since it's a little bit shorter. What is group therapy? When people come together, right? They grow, they learn, and there's different things in group therapy that helps that happen for the patients. Universality. I'm not alone. Other people have the same or similar problems that I have. Altruism. When I help people, I feel better, which then leads to our own self-worth. And then as a group leader, which as nurses, especially as RNs, we will be the group leader and we model therapeutic behaviors. So there's different factors that we see in different types of group therapy. Interpersonal learning. We want to teach patients. Catharsis. Sometimes just letting people word vomit, just talk about what's going on. Socializing. Patients, especially maybe with schizophrenia, who don't quite realize what's going around them, we help them build social skills. And then again, that universality, that altruism. There's different phases of group development, and honestly, they're very similar to the nurse-patient relationship and the phases of that. Planning. We talked about how if I was going to start a coping skills group for nursing students at Galen, right? I would name the group. I would say, we're going to have this coping skills group. I'm not creative. It would not have a fancy name. The objective of the group is to teach nursing students at Galen coping skills, self-help, so they can be better, so they can make it through nursing school, so they can be better nurses. Their participants would be students enrolled at Galen. And what would we do? So in that group, as the leader, I would come prepared to teach everyone, and the members would just kind of need to show up, maybe do some homework. The orientation phase is when we as the leader structure the environment. We set the ground rules, right? An important one's talking about mutual respect. We are going to be respectful. Confidentiality, what we talk about in group doesn't lead group. We're going to talk about why we're in the group, what's the purpose, and introduce everyone. The working phase, right? So in our coping skills group, we come together, I direct the flow, and we're all talking about what we do, what we don't do. It's where we learn. It's where all of the stuff happens in the group. And in the termination phase, right, we're ending. Everyone's coming back and saying, I learned this stuff. We're summarizing. I realize that when I do this, this happens. I realize that this coping skill works really good for me. There's different roles of participants, and they can help or hinder the group. Task roles keeps everyone on task. Maintenance roles is the glue that ties everyone together. And the individual roles more personal or agendas. What can I get out of the group? I don't really care about the rest of you. I care about me in an individual role. There's a few different types of leadership, and if you've ever taken a management class, you see the same thing. Autocratic leaders, this is more like there's a fixed time limit. I am talking about this stuff. This is about, this is what we're going to accomplish. You might see this more in an inpatient unit because we don't have time to form a team. Democratic leaders, it's a lot about the group. You may see this more in maybe a residential or maybe an AA type meeting where it is more about the members. It is more about that psychotherapy. Those are more therapist-led groups than nursing groups. Laissez-faire leaders, we kind of there might not be any rules. We're not directing the group. Let's all come together as a group and work on our individual art products. Now, group leaders use communication techniques just like your therapeutic communication techniques, right? So reflection. Hey, I noticed you kind of looking at the floor and, tears forming in your eyes. Can you tell me how you're feeling right now? If the client then says I felt sad about this, right? Universality. Would anyone else like to share similar feelings? Active listening. If we as leaders need to be listening to the people in the group, we need to be asking questions. We need to clarify, I heard you say this. Can you tell me more about it? And then we got some problem group members. The monopolizing group member is going to be the one talking, and they're not going to let anyone else participate. They're going to address the entire group. We as leaders need to make sure that everyone has a chance to talk. So we're going to speak to that person, and we're going to be like, look, you're talking a lot. I need you to tone it down. Can you share maybe just 2 or 3 times so others in the group have a chance to share? The demoralizing group member is the worst. They're going to challenge the leader. They're going to be angry. They're going to be rude, self-centered, and it's not their fault. There's no responsibility. We need to speak to the person in private and find out what's causing the anger. The silent group member, little to no response. They might be scared. They might be self-conscious. They might be anxious. We need to give them a little bit more time to process. And we could ask them to write everything down. Hey, I want everyone to write down a few sentences about a time when this happened to you. We'll give you all 5 minutes, and then we'll go around and share. And give them the time to write down their sentence or two so that they're not as nervous about when it comes to sharing. So why do we do groups? Well, it depends on the type. Educational groups, we want to teach something. So my group on teaching coping skills to Galen students would be an education group. I want nursing students to gain knowledge about coping skills and self-help, about boundary setting. A therapy group could be someone, if we're talking about individuals maybe with like a personality disorder, or AA, right? Alcoholics Anonymous, gain insight. Wow, I never noticed how my drinking affected my family until Joe shared about this time with his family. That's something similar to what I've had. And we gain this knowledge in a therapy group about how our behaviors are affecting others. And we have a behavioral change. And then if we're talking about AA, a reduction in symptoms, we want less drinking. And that's group therapy in a nutshell. That was super fast. If y'all have any questions, please reach out and let me know.